Hello there. My name is Calliope, and as I understand it, we are doing a manual lymphatic drainage, or a lymphatic drainage massage for you today. Is that correct? Wonderful. Might I inquire about why it is that you sought this treatment out today? I see. Yes, we can absolutely address that. So tell me a little bit about what you know about manual lymphatic drainage or lymphatic drainage massage. Okay. Would you mind if I tell you a little bit about it? Wonderful. I do love talking about the history. So, manual lymphatic drainage has been around for about almost 100 years now. It was developed in the 1930s in France by Dr. Vader. He noticed that when he would receive patients that had chronic cold-like illnesses, that their lymph nodes would be quite swollen, and he wanted to design a modality that addressed that issue. Nowadays, we use it for lymphedema. We can see that in cancer or maybe an infection where lymph nodes were removed. We can use it to promote healing after surgery. We can use it for pain and stiffness associated with rheumatoid arthritis or fibromyalgia, or sometimes it's just kind of a nice pick-me-up to get your lymphatic system flowing. This is an extraordinarily gentle massage. We are primarily working with the skin. We're not going to be getting into the muscle. So this doesn't use any massage oil or lotion at all. It's just going to be my hands and a few different techniques. Does that sound like something that you wish to do? Wonderful. So let's go ahead and get you set up, and then we can dive right into the treatment. I'm just going to pop on my glasses so I can see you a little better. Now, how is this? Does this feel comfortable for you? Excellent. So, to start this manual lymphatic drainage, I'd like to first guide you through a bit of deep breathing. And that may seem a little strange, but actually deep breathing is very helpful for moving the lymph around and getting it ready. So I'm going to be putting my hands on your ribs, and I'm going to have you breathe with me a bit. So if I could put my hands right here, is this okay? Good. So right here. And I'm just going to have you take a very deep breath in and out. Good. We'll rest a moment. And deep breath in and out. Good. Have the abdomen fill, the lungs completely deflate. Take another deep breath in and out. Good. Deep breath in and out. Wonderful. And one last one. Deep deep breath in and out. There. Now we're going to start by preparing the lymph nodes. So think of the nodes like a bathtub. And if the bathtub is already filled with water, if we add more water, there's not really anywhere it can go except overflow, right? But if we do drain the water beforehand, then we have all that room for that new water to come in. So to do this, I'm going to start with the area right around the supraclavicular nodes, right in here. So if you pull up your shoulders a bit, there is a dip in here, and that's what I'm going to be working with to start. So I'm going to go ahead and get closer to you here. There we go. And we're going to start with some stationary circle type movements. I'm going to come in here and I'm going to get into this little dip, and then we're going to stretch the skin and release it and let it carry us back here. Stretch the skin towards the sternum a bit. Good. And this is extraordinarily gentle. We're just letting the skin do a lot of the work for us. We're guiding it a bit, and it takes us back. Good. So, how the lymphatic system works. How the lymphatic system works is that it is your body's sort of detox system. And if 100% of your blood comes out of the heart, about 90% of it makes it back. It's a bit of a rough estimate, but a good ratio to work with. Leaks out, and that gets picked up by our lymph and taken back to the blood to be reabsorbed. And let it go. Good. Now I'm going to work with the axillary nodes. I'm going to go ahead and lift your arm here, and you can just let me take the weight of it. We're going to be doing almost sort of a pumping technique with this, pumping motion, and I'm just going to be pressing inwards here towards the midline, and then letting the skin relax back. In, relax. Pressing in and relaxing. So your lymph, made up of that blood that doesn't come back to the heart, made up of white blood cells or lymphocytes, and proteins and fats from the intestines, that is very vital for your body to fight off infection and keep the fluids balanced. So if the fluid didn't drain to the lymph nodes and get reabsorbed, well, then we'd have a lot of places in our body that were pretty swollen all the time. Good. Now I'd like to get into the other side here. I'm going to lift the arm. And we're going to press in and let the skin carry us back. Good. So, as I had talked about before, sometimes there are diseases or situations where our lymphatic system doesn't work correctly. And this helps to reincorporate all of that fluid, all the swelling, back into the blood. Good. Pressing in, letting the skin release, pressing in, letting the skin release. And we're just letting this drain out before we push any of the other fluid into that area. Just draining the bathtub before we add more water. I'm going to lay your arm down here. And now we're going to work with the neck a bit. So I'm going to be working the front as well as behind. So I'm going to come in here and I'm going to be pushing back and down. I'm letting it carry me back and down. Good. Gentle, slow. Just letting everything drain out. And then the back of the head here, going in towards the spine and down. Good. There, okay. So let's go ahead and work just behind the knees here. So I am just going to be taking one of your legs here. Work here, and with my fingers behind the knee here, we can work by doing a bit of rolling in here. And this also works almost like a sort of pump. Just very gentle. This work is only working on the skin. as our lymph system is quite shallow. It's not often that we have a massage behind the knee, huh? Usually the only time someone is in this area is if they are taking the popliteal pulse. And that one can be kind of difficult to feel for. Let's start with the face. So I'm going to be working under the eyes, above the lip, and below. And we're going to be pushing outwards to the pre-auricular nodes. So we can start right here. That, work out. Good. Soft strokes. A little lower. Not so much a kneading as just mostly a stroking, an effleurage. Good. There, and how is this feeling for you? Okay, good to know. It's just light strokes. Nothing should be painful or uncomfortable. Okay, and then we also have, we can do a little bit from the tip of the nose out. And go up a bit, a few strokes each. And we can do a bit of brow pinching in here and just work towards the ear. I'll just do one side at a time. A little bit of brow pinching. One also sees brow pinching in Ayurveda as well. There we go. Just a little pinch, 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 all the way to the ear. Just moving the fluid where we want it to go. Clear everything out. And then we also have the forehead here. And move to the ears. Just like that. Okay. There. And now we can work with the chest. So we can work the area kind of in this area up into the shoulder. So I'm going to move your arm here. And I'm going to be starting right about here. And we're going to stretch up. We're going to try to bring this over the collarbone here. So I'm just going to stretch up and let it release. Just like that. Stretch up, release. Up, release. Good. Release. And these techniques are super easy for you to do at home if you want. Sometimes if we've been on our feet quite a bit, or we just haven't got as much activity as we have needed to, sometimes we can feel a bit heavy and our lymph system isn't moving as much as it needs to. And you can do some of these techniques. Just as long as you don't have an active infection, serious illness, that sort of thing. Put your arm back here and move the other one. Good. And just lean over here so I can push up and let it stretch back. Just these gentle stretches. Now, in addition to these stretching maneuvers, one also can see rotary circles as well. That's more for the back, but we're focusing more on the anterior body here. So it's mostly these stationary circles and the pumping technique. There. Good. And now we'll be working into the arms. So at the very top we have the shoulder, and maybe working the back of the shoulder and coming in towards the neck here. In, letting it release. In, letting it release. Should be about 1 stroke per second. It does tend to be a slower paced massage. Good. And I'm going to work one arm before moving to the other. And then I'm going to just hold your arm here, and I'm going to bring a couple of my fingers here just below where the shoulder is, and we'll come up and wrap this around and then let it stretch back. Up and back. Just like that. There. Is that still feeling okay? Yeah, this is kind of a strange place to get a massage. But we're working this fluid into this axillary node here. And then for the whole arm, we're going to be working with that pumping technique. So this is going to be a very gentle sort of stretching the skin up, letting it release. But I'm using the inside of my first finger and thumb as kind of a scoop, almost. Going up, letting it carry me back, that sort of thing. And we work proximal first, down to distal. So we're almost clearing everything first, and then funneling everything else. It's almost like a gentle kind of squeeze. There's not a lot of pressure behind it. And we can even work the fingers as well. So with the fingers, again, we'll work proximal to distal. And we just get each finger flowing with our index finger and thumb here. Good. And the other side, we have the shoulder. So I've got my 2 fingers coming right here, up and over, back, over, back. Everything has a sort of flow to it, just like water. Just like the lymphatic system. Good. Letting everything clear out. You might feel quite a bit lighter when this massage is done. You might also feel quite tired. We've worked a lot. And then we have the pumping technique here. I'll give you a little bit of aftercare instructions when we're done. Since we're working with so much fluid, it's important to replenish that fluid. And you're going to want some rest as well. Okay. And then those fingers here, we have the pinky, the ring finger, middle finger, index, and the thumb just has the 2 joints. Good. Now we'll get into the upper leg. There. So we're going to start at the top of the leg here. Now for this, I'm going to have one hand that's more on the inside of the thigh and one hand that's on the outside, so that I can use both hands to direct the fluid upwards. So right in here. So we'll go up and release as needed until we get to the knee. Stretching the skin up, letting it go. Up, back, up, back. And the lower leg is going to be quite similar. One hand is on the shin and one hand is on the calf. And we work proximal to distal, stopping at the ankle. The hands and the feet don't get a lot of love in this massage. We have the fingers and toes and the legs and forearms. Not so much the hands and feet. So for the feet, I'm going to be doing the same thing that I did with the fingers, with each little bit here from proximal to distal, getting squeezed a bit, moving the fluid back. Upper leg, and the lower leg. In these waves, making sure everything gets moved up towards the heart. The lower extremity is more drained into the inguinal nodes, while the upper tend to go into the supraclavicular toes here. Give them a bit of a squeeze. There. Good. Is going to almost finish our massage. I'm going to have you get back up. We'll do one last thing to finish everything up. Now to finish the treatment, I'd love to do one last deep breathing exercise just to make sure everything is flowing. So do you mind if I put my hands on your ribs like we had done with that first exercise? Wonderful. So I'm going to put my hands right here, and I want you to just take a very deep inhale. Feel the oxygen fill the abdomen. And then exhale all the way. Almost feeling the body curl within itself a bit. And inhale. Good. And exhale. Exhale. Inhale. And exhale. Inhale. And exhale. So following this treatment, the absolute best thing you can do for your lymphatic system is to drink lots and lots of water. We need all that fluid to clear everything out, and I'd like you to get a little bit extra rest if you can after this treatment, but perhaps in a couple of days restarting some exercise would be good. Exercise is an excellent way to keep the lymphatic system moving. So, is there anything else that I can do for you? No? Okay. It was an absolute pleasure having you here. I really appreciate having a model client. So I'd like to wish you a whale of a day and a good rest of your night. Thank you. Bye now. Thank you so much for watching this video. I really appreciate it. I create primarily medical, alternative medicine / pseudoscience and personal attention ASMR roleplays. If you want to check out a specific category of my videos, my channel playlists have everything from sci-fi to historical to even fantasy videos. If you want to support my work, consider checking out my Patreon profile in the description box, where I offer early access to videos, exclusive content, and MP3 downloads of my videos. My social